Hi, I'm Dr. Deepika Ganvir, a psychiatrist and director of Mira Hospital Kalyan and Mira NX Ulasnagar. So today we'll be talking about why mental health is so important. WHO has defined health not only as absence of physical disease and infirmity, but also physical health as well as mental and spiritual health for a complete holistic health of a person. Depression is an overwhelming feeling of sadness which occurs for more than 2 weeks, and along with feeling of hopelessness, helplessness and worthlessness. So when all of this occurs, we call the person depressed, and it cannot be treated just by a pat on your back and you feel that, oh, this is the personality or temperament of the person. We have a manual called the Diagnostic Statistical Manual, and which has these signs of depression, which if you have more than 4 of these signs for more than 2 weeks, the patient can be labeled as a depressed. So the signs of these depressed people are feeling of overwhelming sadness, not being able to sleep, decreased appetite, lack of interest in pleasurable activities, and decrease of weight. So depression can be mild, moderate or very severe, and it can go on to, even a person can go on to become a psychotic if it is left untreated. So the earlier the treatment, the better it is. Depression is very common these days because there is a lot of expectation from the society regarding an individual, which was not there earlier. Too much of expressed emotions from Indian parents, very low frustration tolerance in individuals. So depression tends to be much more commoner than it was in earlier generations, and it can be genetic. In children, usually depression is not very presented very clear cut as in adults. They don't come to us with having sadness of mood and crying spells, though that can also be a presentation at times. But usually children come with scholastic backwardness, decline in academic activities, and not playing with their peers or relating to other people. So that is the most common sign of depression in children. In adults, we had already talked, there is this overwhelming feeling of sadness, hopelessness, helplessness and worthlessness, which occurs in adults as opposed to children. And of course there is a socio-economic decline in their work and other relationships which they build up with people around them. So either depressed people can become very withdrawn and keep to themselves, become introvertish when they were actually very outgoing at one time, totally lose interest in other social and pleasurable activities which brought them interest at one time, like seeing TV, interacting with their friends. They may not do that as usual. And of course all other areas regarding marital status and workplace and other places, there is a massive decline in interacting with the people. Depression causes, it has a lot of other comorbid diseases along with it. It brings along a lot of other comorbid diseases, psychiatric disorders, and the major one is drug abuse. So substance abuse, like taking up alcohol when a person is in depression, or taking up other drugs like cannabis, brown sugar, opioids, and other things is also a part of depression. It's like the patient is trying to self-medicate themselves by taking up these drugs so that their pain is relieved. So they, instead of going to professional health people, they start taking these medicines to soothe themselves. So that's how they start their substance abuse. That is why we say that they should really visit professional health care people when a person is depressed, because medicines don't have the side effects which drugs have, like alcohol and taking other substance abuse deteriorates their health on the whole, worsens their mental status, and there is also physical decline, because all these substances can poison their body very slowly, and there can be a total physical decline and even death because of these drugs. So when a person is depressed, obviously you get to know that they are depressed because their face looks very sad, they become withdrawn, they become shriveled, their body language is also not very forthcoming, and they may even lose weight. There may be dark circles under their eyes because they are not able to sleep well. That energy level which you see in normal people also is on the decline. Treatment for depression is more of the first step is to be very supportive towards a person who is depressed. So you have to first recognize that a person is depressed, support them through this whole episode, which may last for about 6 months if it goes untreated. Secondly, start counseling them. A lot of these depressed people do have some very irrational beliefs, and they have some stressors which has triggered off this depression. So to get them away, or to make them realize that this is just a small trivial point in their life which is causing this depression, so to counsel them and to get them away from this. And of course, last of it is that we may have to start some of them on medication. So it's not a very big thing. It's just like taking treatment for any other physical illness. Depression also has been very well treated with antidepressants nowadays, and it's not a very big thing. So seeing a healthcare professional and initiating treatment with antidepressants for brief periods of time is very, very helpful. No, I don't think that these medicines are addictive. See, it is like a person who has diabetes. When a person has diabetes, he has some kind of problem in his body where this chemical insulin is depleted, and so it has to be replenished from an external source. So similarly, in depression, the most common chemical which is depleted is serotonin, and this is what these medicines do. They just replenish the serotonin level and bring it up to a certain level, so you can be working at an optimum level, and it need not be taken lifelong, and they are not that addictive if they are properly tapered off with the help of a healthcare professional. And it has been very well illustrated by Deepika Padukone, who had talked so extensively about her own depressive episode. And there are a lot of other famous people also who have undergone depression, and all this is now becoming a very trivial thing. First thing a person has to do when he is depressed, if he does not want to go to a healthcare professional, is that at least recognize that I have an illness such as depression, and he should talk out to his family members or have a good circle of very mature friends with whom he can talk out, and there are certain very irrational beliefs or irrational thinking which a depressed person has, and if these things can be corrected at the level of the family or at the level of the friends, then the person need not go on to need not progress to a very moderate and severe level of depression. So the thing that these depressed people have to do if they don't want to visit healthcare professionals is at least talk out with their family and their friends and strengthen their own self-esteem so that they can overcome their depressive episode. And in case this is not the solution or it does not regress, then they may have to visit a healthcare professional for further treatment. So a person should be really should have a good sense of self-esteem. Parents should bring up their children with a lot of positivity. There are people who will be willing, who will be trying to put the person down in professional places or other places. Now these things will have to be combated with a strong group of friends or family support, and this is the person himself will have to increase his own self-esteem to be able to overcome any major stressor which comes your way in life, such as a divorce or death of a person or other stressors like a job loss or something. That has to be talked over with friends, family, and it has to be understood that it's just a point in life that this is happening, and this point will also pass away. So this will be overcome, and subsequently the person will not feel so depressed. Hi, I'm Dr. Deepika Ganbir. Find, connect and follow me on medicalwale.com, आपके हेल्थ का साथी.